the casualty has suffered a broken bone or fracture, you will need to immobilize the injury by splinting it. Immobilizing the broken bone will provide support and keep it in place so the injury doesn't get worse. Before splinting, first be sure to control any bleeding or hemorrhage and treat the casualty for shock. Establish that the casualty circulation is not impaired prior to splinting. Begin by exposing the site of the fracture. If the bone is exposed, as in a compound fracture, be sure to cover the ends with sterile dressings prior to splinting. Splint the fracture in the position that it is found. The splint can be any sturdy, straight piece of solid material that will support, stabilize, and immobilize the injured limb. To avoid further injury, never try to reposition a fracture or put back an exposed bone. Only properly trained medical professionals should readjust the injury. Move the fractured part as little as possible while applying the splint. Pad the splint at any bony prominences such as the elbow, wrist, or ankle. Immobilize the splint above and below the fracture. Reassess circulation after the splint is secured. When in doubt, treat all injuries as a possible fracture. Evacuate the casualty if needed and seek proper medical attention. A muscle strain occurs due to the tearing of muscle fibers or tendons that connect muscle to bone. Although they are often not severe, they sometimes require medical attention. If the strain is severe, immobilize the injury by splinting it so the affected muscle is immobilized in a relaxed position. As a guideline, use the acronym RICE, R-I-C-E, which stands for Rest, Ice, Compress, and Elevate. Rest the injured body part. Ice the injured body part. Compress the injured body part with bandages or ACE wrap. Elevate the injured body part above the heart, but only if it does not cause more pain. A sprain occurs when a ligament connecting bones and joints is stretched or torn. Sprains can result in significant pain and swelling depending on their severity. If the casualty is suffering from a sprain, treat the sprain like you would treat a fracture. As a guideline, use the acronym RICE, R-I-C-E, which stands for Rest, Ice, Compress, and Elevate. Rest the injured body part. Ice the injured body part. Compress the injured body part with bandages or ACE wrap. Elevate the injured body part above the heart, but only if it does not cause more pain. If necessary, evacuate the casualty and seek proper medical care. Dislocation occurs when an injury or impact forces a joint out of its natural or normal position. These may often be caused by intense impacts or sudden force. Dislocated joints can become swollen, painful, and often are visibly out of place. If the casualty is suffering from a dislocation, first, immobilize it. Splint the body part as found. Only properly trained medical professionals should readjust the injury. Monitor the casualty and treat for shock. Evacuate the casualty and seek proper medical attention as soon as possible. If the casualty has suffered a head, neck, or spinal injury, first, request professional medical response right away. If the casualty has suffered a head injury, control any bleeding as needed. Control hemorrhage with a pressure dressing. Apply pressure only to the affected vessels. Immobilize the affected body part. A SAM splint may be applied to the neck as a brace to further immobilize the head, neck, and spine. For spinal injuries, the casualty should be immobilized from their head down to their pelvis. Carefully place the casualty on a firm, flat surface to stabilize the spine. If full immobilization is not possible, prevent excessive and unnecessary movement of the casualty. Treat the casualty for shock. Monitor and maintain the casualty's airway and breathing. Cautionary note: avoid providing pain medication. Evacuate the casualty and seek medical care as soon as possible.